Today we'll be discussing a treatment plan for Joe that is consistent with cognitive behavioral therapy. The main goal of Joe's treatment is to help him understand the relationship between his thoughts, feelings, and behaviors, and to help him change his maladaptive thoughts in order to have better behavioral outcomes. We will begin by developing a style of interaction that is consistent with collaborative empiricism. In other words, I will develop a working alliance with Joe so that he can feel comfortable expressing himself and having a role in his therapy. We will use mutual goal setting to allow him to take ownership of his progress. The first step is to help Joe identify his thoughts, most especially his automatic thoughts, such as, I must fight back to protect myself, and even though certain things are wrong, I must do them to provide for my family. Part of this process will be assigning Joe homework. This will include giving him a notebook to use as a thought record. He will identify the situation, thought, response process to see which situations elicit certain thoughts and feelings from him that cause him to engage in negative behaviors. Eventually, Joe will add another column to identify realistic, adaptive thoughts to counter his maladaptive beliefs. Joe and I will use the thought record to identify situations that cause him stress and engage in relaxation training to help him learn breathing techniques that he can utilize as an adaptive coping skill in stressful situations. As we work to change Joe's maladaptive belief that he must be completely responsible for the protection of and provision for his family, he will make a reattribution pie chart. We will examine his unrealistic expectations with the goal that he will realize that he cannot nor should not take on such an adult responsibility. Toward the end of therapy, I would like to meet with Joe's parents to discuss his situation and explore other resources that may help the family monetarily and alleviate some of Joe's stress.